okay?
We'll get the important part.
Not really, but you,
Yeah, really. I don't want to use this because it's too small. When I did the demonstration on Friday, I tore my gloves. So knowing that, I need to be prepared. I've got a pair of 8, okay? So know what you wear, okay? So when you do sterile procedures, you know what to bring, okay? So go ahead and open it, and remember that you want to take your gloves out of your kit onto a surface. And I'm already establishing my sphere. Remember, you want to make sure that you're in your sphere, that you're not going to turn your back on your sterile procedure.
How often do patients have this done? I mean, I know it's specific to each patient, but you can do like a one-time thing, but is this like every week they have to have it changed out, or every 3 or 4 days? Do you remember?
Change a Foley? That's another matter
That's a whole
altogether.
other, okay, yeah, all right.
Okay, so now I'm gonna leave that where it is. Okay, now I'm entering my sterile area. This, I don't wanna use this fenestrated drape, I can simply toss it. Okay, now remember when you're tossing trash, you don't come out of your area to toss things. So, and the right way to do it is to toss it. The wrong way to do it is to take this and come out of your field and do something like this, okay? So you simply wanna stay, again, I don't wanna use this, I'm just gonna toss it out of my way. That's fine, just leave it alone, okay? So let's go ahead and separate our kit here. We're gonna put this closest to the patient, okay? Now remember, we have 3 things we need to accomplish, and you can do them in any order, okay? I think I'm gonna go ahead and check my bulb first, okay? So remember, that hook's on there, so you have to break it or get it out of your way, okay? That's your sterile water. Okay, I can go ahead and connect that. And remember, when you take this off, you wanna be careful that it doesn't sling and do something like this. So what we may see is if you open it and it hits the patient's leg, okay? So then you would want to start over. So we can do it something like that, get control of it. I'm gonna go ahead and lay it down. I'm gonna get my lubrication ready next. Lubrication, I'm gonna go ahead and just slather it in there. Empty all of your contents. Okay, I'm just gonna toss that right there. That right there is your container if you need to get a specimen, okay? But we don't really need one, okay? But it's there if you need it. Okay, so we've done our balloon. We need to test our balloon. That's the other piece. We want to go ahead and connect that, and then leave it intact once we test our balloon. You don't have to do the whole thing, but you do need to test it to make sure that it's intact, okay? So we've tested our balloon, we've attached our water, we've left it intact, we've opened our lube, our lubrication, and we're gonna go ahead and slather it, okay? And then we could open up we've got 3 iodine sticks here. We're gonna go ahead and open it all. My recommendation is that you take all 3 of them out, okay? And then just lay them down, okay? We can just toss that out, okay? So now we're ready, okay? I'm gonna go ahead and designate, this is my sterile hand, this is my dirty hand, okay? I'm gonna go ahead and separate the labia, okay? And I'm not gonna get iodine on the mannequin, but I'm gonna go ahead and use it and show you the moves that I would make. We're gonna go ahead and separate the labia. We're gonna go in, okay? And we're gonna go around our trash, okay? Not over or this way, but this way, okay? Keep them separated. We're gonna go in, okay? And then our third one, we're going to go straight down the middle, okay, around. Now I'm ready for my insertion. We want to go ahead and continue to keep the labia open. Now I don't think that this is gonna, this opening is not gonna be big enough, I know that. So for our purposes, I'm just gonna use the vagina, but we would simply go in the, we would locate the meatus, which is at the top. This will not fit, okay? So we're gonna go ahead and make our insertion here. Now, you can keep in mind that with every small pass, you can consider that an inch, okay? So that's 1, 2, 3, so that's 3 passes, okay? And so I see urine now, okay? So now I'm gonna go another couple of inches for a total of up to about 6, okay? 1, 2, okay? I've seen my urine, my flash, okay? Now we want to enlist the help of this hand because the sterile part is essentially done, okay? Now we're converting to like a clean. So go ahead and release, okay? And then hold here and then take your finger so you can secure it, okay? Because if you don't secure that, when you try to inflate your balloon, it's gonna come out, okay? Does that make sense? So we're gonna go ahead and inflate. And you want to be mindful that when you make your inflation, you want to make it just a slow, steady, not to like jam it in there, okay? So just a nice, steady flow there. And I'm looking at my patient to make sure no complaints, okay?
Can you
So
put all the fluid?
Mm-hmm.
Okay.
So now we can let go of this hand to have help to get rid of that, okay? All right? So now we really just need to finish things up, okay? So what I would do is I would go ahead and gather all my trash, which I'm gonna do, okay? The only thing I'm gonna save is this for the DC part, or the discontinuation part. I would trash this, and I would take my gloves off, wash my hands, and put regular exam gloves on, okay? So now we're gonna go ahead and get our patient reset again. Save that.
When do you pull to make sure the bulb is?
Oh, yes. So when you're in, you want to give it a gentle tug, just to make sure. That's called seating it. You're basically pulling it away from the so it doesn't stick to the bladder wall. So you're gonna give it just a gentle tug, and it's already tugged. I don't really need to do much more, okay?
And you'll feel it, right?
Mm-hmm. Really, you're pulling it away from the wall of the bladder, okay? So it doesn't like get stuck on the bladder wall, okay? And then we're gonna go ahead and secure this, okay? So when we do that, we can just keep in mind that we want to leave a little slack there, okay? And we would secure it right there. We can cover our patient up now, okay? And then we're going to take this and then just put it on the bed frame, okay? Our documentation pieces, we want to make sure that we document the name, the date of birth, the time, the date, what we put in. We put in if you forget, you can just look. We put in a 16 French Foley catheter. We inserted 10 mLs of sterile water, and we saw 300 mLs of clean yellow urine, okay? Okay, that's the insertion piece as well as the documentation piece, okay? Now, a couple of days later, we have an order to discontinue the Foley catheter, okay? So we wanna make sure that we come in with a few items. First of all, we can go ahead and empty our Foley catheter, okay, note what we emptied, so when we get done, we can just put everything on our biohazard bag, which is gonna be our next item that we bring. We're gonna put something under the patient. We've already got something there, okay? And then just a 10 ml syringe to remove the sterile water, okay? So I've emptied. I'm gonna go ahead and put that there, because it's getting ready to go into that red bag.
But
okay?
you wouldn't use that same bag for 3 days, right? That would have been empty, wouldn't it?
Well, we empty urine every 8 hours.
That's
We
what I
account
mean,
for
yeah.
output every 8 hours, yeah. But you can keep in a Foley for, it's gonna depend on your facility. It's gonna be facility specific, okay? But really and truly, we wanna try to get Foleys out as soon as we possibly can, because we are dealing with more, and it increases the risk of infection, okay? And so, you just put that in there. You can let the water come out on its own, essentially. Okay, we can give it a little help. You've accounted for all 10 of your mLs. Okay. And we can tell our patient they can take a couple of deep breaths. Essentially, you see it, it almost kind of falls out on its own, okay? So you can just kind of wrap all that up and clean our patient. There may be some dribble, okay? We can go ahead and
Discontinuing it, it's just a clean, right?
Discontinue is just a clean procedure. Okay, and all that goes into my red bag. Okay. Any questions?
And of course, that would go in the sharps though, right?
This would,
Okay,
yeah.
yeah.
Well, essentially, it doesn't have a needle on it, but
And
I
what's a-
may just, since it's a needle, I probably would, but it doesn't have any kind of sharp on it. So it could essentially go into the regular trash, okay? Okay?
Is,
Yes.
when you give it slack, when you're, right after you put
When you're gonna
everything in-
anchor it here on the leg.
Yeah, how do you anchor it? Like with, you just put a
Med
bunch of pieces of tape over it?
Well,
Or-
you can do what they showed in the audio-visual, where you can
Oh,
go
yeah,
ahead,
sorry. Yeah,
you can
yes.
go ahead and do, you can go ahead and start with a piece of tape, and go ahead and you can actually put a piece of tape around the tubing.
Okay.
And so really you've got a tape, and then you're putting a tape on a piece of tape, meanwhile the tubing is up underneath it. Really and truly, most facilities have what's called a stat lock, okay? It's a device that simply has an adhesive for the patient's leg, and you're just putting it in there and you're snapping it into place, okay? But you can do what the audiovisual showed, which is two simple pieces of tape to hold it in place, okay? All right.
Thank you.
All right.